This presentation will be on Evolutions Treatment Center, which is a substance abuse treatment center that is located at 2901 West Cypress Creek Road, Fort Lauderdale, Florida. Here's their 800 number. It is 800-795-8527. And that phone number goes to their admissions team. They can also transfer you over if you ever needed a call to speak to a certain therapist or a client there or something like that. They are open 24 hours per day. They actually answer that phone 24 hours per day. And their clinical hours are from 7:30 a.m. to 4 p.m. So that's when the therapists and everyone who works in the office are actually in the building. Their mission statement and structure. So the mission statement of Evolutions Treatment Center is to break the stigma surrounding addiction and eliminate the barriers that prevent Americans from accessing the treatment they need for a successful recovery. They aim to provide compassionate and personalized care to individuals dealing with alcohol, substance use disorder, and behavioral health challenges. Their fee structure, they take self-pay, so you can pay cash if someone is able to do that. They take Medicaid, they take private insurance, and they also occasionally scholarship clients. So that would be, taking on a client without receiving payment for them. So those seem to be kind of few and far between, but it is listed on their website, so I wanted to mention it, that sometimes they may offer a scholarship. This is a private agency. They are independently owned by one family, and they don't have a board of directors or anything like that. They have one owner who has the decision making, as far as I know. Client population. So they are 18 plus facilities. You have to be an adult to attend their facility. They refer adolescents to another facility, so they don't deal with adolescents at all. Most clients are voluntary. Some are court ordered. So some are on mental health court, and some of them are court ordered because of criminal offenses and things like that. I've seen clients there that have ankle monitors and that type of thing that are stipulated to complete a certain amount of treatment, like 30 days or 60 days, something like that. But the vast majority of the clients are voluntary and they're checking themselves in. This is a PHP program and it can house 85 clients at one time. That's how many beds they have. A typical caseload per therapist is 18 to 25 clients. They have a client-focused approach, and clients usually have decision-making rights as far as their length of stay and what level of care they wish to complete. So basically, if a client goes in and they only want to complete detox, they don't want to come to the PHP level of care, they're able to do that. They'll find them a discharge plan. If they want to just complete PHP, they don't want to go to the IOP, or they don't want to go to a halfway house or something like that, they're able to make that decision for themselves also. So the client can kind of dictate, as long as they're voluntary, the client can dictate, for the most part, how many days that they're going to stay. The therapist will make a recommendation. They should stay 30 days, they should stay 90 days, something like that. But at the end of the day, if a client's only willing to complete 2 weeks of treatment, they're still able to participate in the program. So they have this, they have autonomy when it comes to that kind of stuff. The clinicians make recommendations and they will pick a discharge date that they feel is appropriate, but at the end of the day, the client is able to make that choice. They have a grievance procedure. It's very clearly presented during their orientation, and it's easy to access. Basically, they have a mailbox right on the wall by where the operations director's office is, and it's a grievance form, and they can fill out what happened and their side of what happened, and they can leave it for the clinical director, and they go over all of them. So interventions. The clients participate in individual and group therapy sessions. Family sessions are also offered for clients whose families are in the vicinity, or they can do that over the phone. Clients can move through levels of care: detox residential, PHP, which is this location that I'm talking about. They have IOP, and they also have aftercare, so they have a couple halfway houses. The location, the clinical building, the location is the clinical building. And PHP, so when clients are at PHP level of care, they're provided with community housing as well. So the community housing is a little distance away from the clinical building, so I never actually saw the community housing, but everyone who's in the PHP program does live in the community housing. So transportation is provided for all the clients until they reach aftercare, so they all ride around on those big white treatment vans. So they all get driven over to the clinical building every morning and they get returned back to their residence in the afternoon. Measured success. So remission from substance use and mental health crisis, that's how they would measure success for their clients. Follow-up procedures. So they have a big alumni program. They have an alumni coordinator that reaches out to clients after they've discharged and check in with them about their needs and how things are going. So they also have the ability to continue with aftercare therapy sessions as needed. So even when they complete PHP, IOP, even outpatient, they have the options, a lot of them, to continue to do like periodic sessions with their therapist to keep the treatment going. Referral services, they work on housing, they work on longer term care. So some clients, like after they complete as many days as they possibly can at this program, they want to go into even longer term care. So they'll try to find another program that's like 6 months or 1 year or something like that. Which is, Evolutions doesn't have a program that's that long. So sometimes they'll find another program. And they'll refer them there. And also sometimes if housing is like not possible, they're not able to come up with any funding for housing, they're not able to do halfway house, they also have referral services at a shelter. Context that shapes practice. Changing laws around mental health parity, insurance coverage, and substance use treatment reimbursement directly influence what services are covered and how long clients can stay. Immigration and criminal justice policies may affect client stress level, family involvement, and discharge planning. Rising costs of living, unemployment, and housing shortages create additional stressors that impact clients' recovery stability. Evolutions incorporates CBT, DBT, trauma-informed care, and dual diagnosis treatment to stay aligned with current research. And collaboration between medical staff, therapists, and case managers help address both substance use and mental health needs. So the therapists are constantly working with the case managers to work on things like housing and employment and things like that, because if a client gets out of treatment and they don't have stable housing or they don't have employment and they can't pay any bills, obviously their stress level is going to be a lot higher. And sobriety might be a lot more difficult with stress level like that, not having a safe place to stay. So the therapists really have to work hand in hand with case managers for that kind of a thing. So in summary, the strengths that I see at Evolutions is compassionate staff, solid results. I saw a lot of really good results during my internship in the fall. So I saw a lot of people making good, positive changes in their lives. I was there about 12 weeks. So in that amount of time, I saw quite a few people complete the program. And the people that they were on their last day compared to the people they were on their first day was so different. So they definitely have some good results going on. They're making a positive community. They have a positive community there and positive workplace culture. So the people that work there seem to be pretty happy. Everyone seems like they know their role and they work really well together. So overall, it's a really nice place. I saw a lot of really good things going there. So for weaknesses, there's some lack of referral context for housing for clients without funds. Like, I hate that they refer people to the shelter. I think that's really sad. I think that's, a really stressful place to be when you're in early recovery. And it's not many people. Like, most people, they're able to find like halfway house or, they're able to find a better housing situation for them. But for those people that have to go to the shelter, I just feel like it's going to be so hard for them to continue with their sobriety being in that situation. So, maybe that's something that they could work on to find, some type of better situation for those clients who are without funds, so that they could avoid going to the shelter. So relapse, the risk of relapse I put on there because there's obviously a lot of clients that do relapse. So there's liability there. Um, so that's just something that, that's going to be in any substance abuse treatment center, really. So, I think that something they could do to work on that would be like to provide better Narcan trainings and Narcan services, or to even to provide Narcan to the clients, that would maybe help with the liability issues related to relapse. So for recommendations, I put maybe they could find more resources for clients starting their lives over with limited funds, more employment resources, working on housing and employment earlier in the program rather than waiting till IOP level of care. So right now, they're really just starting to work on their housing and employment towards the end of their care. So, like the last 2 weeks or so, they start working on it, and it's really like not enough time for them to get a solid place to go and a solid job. They kind of are scrambling, so they're just like taking the first job that they can possibly get. So, this would be something that they could possibly work on a little bit more. Where earlier in the program, like at PHP level of care, like really when they start entering into it right away, they could start working, especially on the housing, because it's so important, right, to have a safe place to go and, to avoid those referrals to the shelter. I think it would make a big difference for a lot of people if they started working on their discharge plan right at the beginning of their treatment, so that they just had they were set up for better success, I guess. But overall, it's a really nice program. I think they do a really good job. Like I said, I saw a lot of people complete the program in the 12 weeks that I was there, and the transformations that they made were pretty amazing. So overall, great place. I've enjoyed my internship so far, and I'm looking forward to the spring.